Endometrial cancer is a common cancer among females, affecting mainly women over the age of 45. Now, as with all cancers, early detection is key to successful treatment. Joining us to talk about screening and treatment, Dr. Christina Spears, radiation oncologist with the Cancer Center of Hawaii. Hello, doctor. Thanks for joining us.
Thank you for having me.
Okay, what is endometrial cancer?
So the endometrium is the lining of the uterus, and it's by far the most common gynecological cancer, the most common part of the uterus that's affected with cancer.
Okay, and is it usually detected during a pap smear appointment, or?
No, that's a great question. A pap smear is actually looking at cervical cancer, which is a more worldwide issue regarding cancer, but is fairly well detected using the pap smear here, which dramatically decreases the risk of getting cervical cancer. So with endometrial cancer, generally the first way to detect it is when a patient presents with symptoms.
Okay, and what are those symptoms?
So my stereotypical patient, if you can call any patient stereotypical, is a postmenopausal woman, 60 to 70 years old, who presents with recent vaginal bleeding. So that should be the first tip-off that something's not right.
Okay, I also read that sometimes people don't have any symptoms. Is that true?
That's correct, and that's the more scary part. So, you know, when you don't have symptoms, generally the first thing that tips you off is if it's moved to another organ. So if it's pushing on your bladder or your rectum, areas nearby in your pelvis. Okay,
so if you suspect that you may have this or you're getting some of the symptoms, what should someone do?
Well, first of all, if you have symptoms, go straight to your gynecologist and request testing. That includes physical exam, ultrasound, and maybe even a biopsy. But even for women in general, it's important to know that there are risk factors for endometrial cancer, which may include obesity, never having had children, and diabetes. Also, there are genetic syndromes that can increase your risk of getting endometrial cancer. So if you have these risk factors, minimizing your risk by optimizing your diet and decreasing your weight, if appropriate, talking to your doctor about, you know, controlling your type 1 diabetes or preventing type 2 diabetes, talking to them about your family medical history. These are all things that can hopefully decrease your risk of endometrial cancer in the future.
So again, some of the risk factors that you mentioned is an older female,
yes,
after menopause, obesity, diet. These are all things that can contribute, I guess.
Absolutely,
to
absolutely,
this.
yes.
Okay.
Not only that, but just having a higher level of estrogen for a longer period of time. For example, if a woman's never had children, that can be an associated risk factor for endometrial cancer.
Okay, and why was it important for you to talk about this today?
So, you know, as we mentioned, cervical cancer is kind of the more widely known cancer, gynecological cancer, but endometrial cancer is the most common gynecological cancer that we see in our clinics. So I want women to be aware of that. You know, we always talk about empowering ourselves with our health, and I think anyone can empower themselves by learning more about their health and how they can improve it. You know, from taking their first 1,000 steps out of their, 10,000 daily steps to incorporating more water intake. So whether you're female or male, you can empower yourselves, and our goal as doctors can and should be to empower our patients and the public to take control of their health. So that's why I wanted to touch on that topic.
And we're glad you did. We're almost out of time, but we haven't spoken about treatment. Is this pretty treatable then if detected early?
Yes, if detected early, it is very treatable. Once it's diagnosed by your gynecologist, generally the first step is to be referred to a gynecologist-oncologist so that they can talk to you about surgery, which is most commonly taking out the uterus and the fallopian tubes. I'm not a surgeon, so I'm not going to speak for them, but that's generally the first start. And whether radiation is appropriate in patients with endometrial cancer is really to the discretion of the gynecologist-oncologist as well as to us, so we're usually referred those patients.
Okay, but it's good to know what the signs, the risk factors are, so that people can be aware and go talk to their doctor.
Absolutely.
Yeah, Dr. Spears, thank you so much for being with us today.
Thank you for having me.
Thank you.